Welcome to Diabetes Mellitus, where we're going to talk about blood sugar issues. This is different than diabetes insipidus. This is diabetes mellitus. What is diabetes? So it's an endocrine problem where we have elevated blood glucose levels and not enough insulin produced by our pancreas to transport the sugar into the cells, or we do have insulin but it's just not doing its job. There are two types of diabetes, type 1 and type 2. Type 1, you are born with it. The pancreas is not producing enough insulin or producing too little, and it's usually diagnosed in childhood. Type 2, it is due to lifestyle mainly and a little bit of genetics. Causes being overweight, obesity, and other comorbidities or other health issues. Treatment of diabetes. It doesn't matter what kind of diabetes you have. Treatment is still insulin for both of them. Now, some people take pills like they take Jardians or glipizide or other medicines, metformin for diabetes. But if the sugar is uncontrolled, then we have to take insulin. And also, the doctor will recommend a change of meals, how to eat, what to eat, and also exercise. What are the signs and symptoms of diabetes? Frequent urination, dry mouth, fatigue and weakness, increased appetite, unexplained weight loss, slow healing of wounds and cuts. Also, you can have vision changes, lethargy, fruit or sweet smelling breath, that's usually in DKA, pain or numbness in extremities, which usually happens later on with the diabetes as you progress with the disease. So we said that diabetes is basically not having enough insulin, or if you do have, it's just not doing its job, or the cells are resistant. Maybe you heard about insulin resistance. That's when your cells do not want to allow the insulin to put the sugar into them. And usually that happens when we have some kind of other issues or when obesity is present. So the insulin is produced by the pancreas and it transports the sugar from the blood into the cells. It's like a minivan, imagine, transporting guests from the hotel to the airport. So insulin is like a transporter. And another hormone is produced by the pancreas, and it's called glucagon. Glucagon does the opposite of what insulin does. When blood sugar is low in our blood, glucagon will take the sugar out of the cells and release it into the blood. For example, when you have hypoglycemia or you haven't eaten in a while. Alright, let's talk about complications of uncontrolled diabetes. We're going to talk about DKA, which is diabetic ketoacidosis, with a blood sugar above 300 milligrams per deciliter. It is most common with type 1 diabetics, but type 2 diabetics can develop it as well. It develops when your body lacks enough insulin to place sugar into the cells. So sometimes patients do not take their medicine like they're supposed to, or their insulin, so they do not have enough insulin to carry that carb or those carbs and sugar into the cells, and then they end up in DKA. What are the signs and symptoms of DKA? We have thirst, frequent urination, stomach pain, nausea, sometimes vomiting, increased amount of ketones in the urine, metabolic acidosis, that's why it's called ketoacidosis. It develops fast, and you can also have Kussmaul respirations and sweet acetone breath. So what's the treatment for DKA? First, we are going to rehydrate the patient. they are urinating a lot, so they're losing a lot of fluid. So we're going to do volume resuscitation for the first 24 to 36 hours. We're going to give insulin to correct the anion gap. We're going to correct the electrolyte imbalance and treat the cause. Now let's talk about HHS, another complication of diabetes. This one is really bad as well. It develops over time. It's not sudden, and usually comes when people are sick, have an infection or trauma, something happened. And sugar levels are above 600. They can be up to 1200, that high. So it's extremely high blood sugar, extreme dehydration, decreased alertness, and brought on usually by an infection, heart failure, impaired thirst, bad kidney function, uncontrolled blood sugar. pH is above 7.3. There's a minimal ketone depletion, not so much ketone loss like in the DKA. It takes longer to develop. You can have tachycardia and hypotension later. And there's a high osmolality, which means you have more particles in your body, causing kidneys to reabsorb water and dilute the blood. So now you have the kidneys are reabsorbing the water, putting it back in the blood. Now the blood is diluted, the urine is concentrated, and this can lead to confusion, seizures, headache, nausea, and vomiting when you have way too much water in your blood. How do we treat HHS? Again, rehydration with isotonic solution like normal saline 0.9%. 1,000 milliliters is given in the first hour. We do electrolyte management and we give insulin IV. And remember, only regular insulin goes into the IV. No other insulin can be given via IV. And we're going to diagnose the problem and treat it, see if it's an infection or trauma or what brought it on, if it's heart failure. And while we're giving insulin, we have to monitor potassium levels and glucose levels as well. And this is the end of diabetes mellitus.